I will start over. Well, it is my pleasure to welcome you all to the School of Allied Health, room 107, where many of our lectures are held. I am Dr. Peter Whitley, the internship coordinator for the healthcare management students in the Division of Healthcare Management. Dr. Greenbeer, she is the graduate coordinator. She is responsible for putting this together. So I definitely want to acknowledge the work that she's done to bring this together for you all today. It consists of not only the School of Business students, but the Masters in Health Administration students, and we were hoping to have the Masters in Public Health students as well chime in via video. The next thing that I would like to do is introduce the faculty in the Division of Healthcare Management. And I want to begin with our Division Director, Attorney Odell Stroud. The next individual I'd like to introduce is Dr. Crowder. So, Dr. Vanessa Crowder. So I want to just begin with the introduction of two individuals. Now, I will read some of their information, but I want to just say that the gentleman there, Mr. Jared Donald, he has come up through the ranks of the healthcare management program here at the university. So starting at the undergraduate level, then going into our graduate program, and now he is a fellow at the University of Florida. The other individual is Ms. Brittney Burrell, and she entered into our master's program as a result of already working in the healthcare field. And she chose this program to enhance and refine her skills, and she was selected to be a University of Florida fellow as well. So it was a very, very competitive process. They had almost 70, maybe 100 applicants or more competing for the positions, but FAMUans were selected. So we were really protecting out of that. Let's give them a round. If you would just allow me to read the bio of Ms. Brittney Burrell and then of Mr. Jared Donald. Ms. Burrell is a proud Sunshine State native, hailing from Havana, Florida. In Havana, Florida? With a deep passion for healthcare and service. Taking an unconventional path into health administration, she spent 15 years as a sergeant with the Florida Department of Corrections before transitioning into healthcare. She gained hands-on clinical experience as a medical assistant in emergency medicine, radiology, and dermatology before advancing into public health administration as a medical health care program analyst for the Florida Department of Elder Affairs. A second-generation rapper, Brittney recently earned her Master of Health Administration from the Florida Agricultural and Mechanical University, where she was actively involved in professional organizations such as ACHE and NAHSE. Notably, she and her team were 5th place finalists in the National 2024 NAHSE Everett V. Fox Student Case Competition. She is honored to be one of the first HBCU graduates and the first Black female administrative fellow. Oh my gosh, I did not know that. She was the first. Oh my God. At UF Health Jacksonville, where she is committed to driving meaningful change to healthcare leadership, equity, and access. Bless you. Passionate about creating space for other minorities in health administration, she aims to inspire and uplift future leaders in the field through dedicating her time to mentoring and being active in her community. All right. Yes. And then Mr. Jared Donald is an administrative fellow at UF Health Jacksonville, where he was born and raised, Duval County. He earned an Associate of Arts in Health Administration. I did not know you. Wow. Okay, an associate's degree in healthcare. He has come up through the ranks. Okay, from Santa Fe College, and completed both his bachelor's in healthcare management and a master's in health administration at Florida A&M, where he served as the student representative for the ACHE North Florida chapter. Jared gained early exposure to healthcare leadership through an administrative internship with Atrium Health and built foundational operational experience with CVS Health. He also completed a supply chain management internship with Advocate Health, focusing on data analysis and process improvement. During his fellowship, Jared has supported multiple service lines, including supply chain, perioperative services, orthopedics, and radiology, with a focus on growth, strategic planning, and operational performance improvement. In his free time, he enjoys traveling, spending time with family and friends, and watching sports. Wow. Let's get back. Without further delay, I bring to you these scholars.
Good evening, everyone. I don't know about Jared, but I don't want tonight for us to just be talking to y'all. Y'all have to talk to us. Please talk back to us. We don't want to just be standing up here like throwing things out at you all. But we do want to come and give you all a little information about our fellowship, about fellowships in general, about UF Health and our different opportunities that we have at UF Health. Dr. Wood did such a good job introducing us. I feel like we can kind of skip past that part. We do want to mention that, so at UF Health Jacksonville, we have a fellowship. We also have a fellowship at UF Health Gainesville. And each of those have separate cohorts. So in our cohort, we have 3 fellows in our year. Typically, we take 2. And our co-fellow is Josie Shelton. She is a MHA graduate from UF in Gainesville. She could not join us today, but she completes our little perfect trio. So, and y'all can Jared.
All right, so thank you, Brittney. So just to get laid on is there anybody here from Jacksonville, Florida as well? Okay.
Always one.
Always one. Okay, so I'm only talking to you. For those who are from Jacksonville, who are familiar with the city, Jacksonville is a great city. I'm born and raised there, as Dr. Wood mentioned. As myself, I'm a lovely sports fan. We have the Jaguars. We have our jumbo shrimp baseball team that actually won the national championship last year. We have beautiful beaches. We have an ever-growing city. St. Johns County is actually one of the largest growing counties in the state of Florida. And so there's a lot of great opportunities to grow yourselves professionally and personally. Now I have lived in Jacksonville my whole life, and I am looking forward to moving out eventually. But it's definitely born and raised, and that defines me through and through. So I'm sure Brittney can offer insight on what it's like to live in Jacksonville.
I was living in Jacksonville. I'm from this area. Y'all clearly don't know where Havana is. It's like, oh, okay, I feel better because when she said it, I was like, okay. But so I'm from this area. So going to Jacksonville was kind of a step up. But it's been nice. Jacksonville is a place that I feel like, regardless of what you're into, there's something for you to do. You'll find your people. You can find your interests. Worst thing about Jacksonville has been people in the driving. Like, they don't know how to drive. But other than that, you'll be fine. So let's talk about our preceptors. So our preceptor is our CEO, which is Patrick Green. He has almost 30 years of experience in the healthcare field. He's been with multiple healthcare organizations. He kind of has a reputation for being like a change maker. he'll go to an organization that isn't doing so well, and within 2 or 3 years, they shift the organization into a profitable organization. And that's kind of what's happening with UF Health right now. He's been there now going on 2 years.
Yes, it's turned up his third.
This is his 3rd year, so I don't know, he might be ready to leave soon, but we are doing amazing. The numbers and everything have been improving under his leadership. And he, just to speak to him personally, very personable person. I was telling the professors that I feel like we've had a different fellowship experience because our executive leadership is not your typical executive leadership. They are not the buttoned up, stuffy, like stoic type of leadership. It's not random at all for you to walk into our admin suite and they are laughing and just kind of hanging out. They actually like each other, which makes a big difference. And it also makes a really nice environment for us to be able to learn. We don't feel intimidated going to them and saying, hey, I don't know this, or hey, I want to explore this. They're very supportive. He will text us. He calls Jared quite often. So there are really personal relationships, and you'll, as you get into your career, you'll understand exactly how important that is. This is Karen DeCruz. She is our COO. She came to UF as the CNO, and I believe within 2 years, she was promoted to our COO. She also has more than 25 years of experience in healthcare. Her and Patrick have worked at different organizations together doing those changes, so she has that thought process as well. A lot of knowledge, very good resource. She is a big advocate for us. We stay in her office. She tells people all the time, there's always a fellow in her office. And it's Jared. Jared mocks her. He does a really good Karen impression. She kind of likes it. But again, she is also one of those people that's very personable, very easy to talk to. She loves taking us out to dinner. We love going to dinner on her card. And that's the kind of leadership that you would be coming into. So I do think it would make a big difference for anyone that's coming in as a fellow in comparison to what I heard other fellows say. It really does make an environment for you to be able to explore and feel free to really grow and not worry about messing up so much. There's mental safety. These are our program directors. Both of them are previous fellows. Katie Whitman is, she has been the program director for the fellowship for about 8 years now. She actually came in as a fellow and has since grown through the ranks, and she's now the director of the Department of Surgery. Sarah Petty also did a fellowship. She did her fellowship with Brooks Rehabilitation in Jacksonville, and she's currently the director in planning and development. This is her first year as our program director. Both very nice people. They are somewhat hands-on. Sarah's more hands-on than Katie. I think Katie's plate is very full all the time. But they are always accessible. Jared works downtown, so their office is literally like 5 minutes from him. Always able to call, email them. So, and these are the people that will do a lot, that you'll be working with a lot in your first couple of months. And just them getting you exposure to the people that you may be working with potentially on projects, different potential opportunities, and setting up those one-on-one meetings for you to make sure that you're introduced to everyone at the organization. So UF is a enterprise. So I know a lot of people think of Shands. Shands and UF are the same thing. We are going through this one UF health system, and in that system we have our different regions. So our region is the Northeast Florida region, where Patrick is the Senior Vice President. And then we have our President and System CEO, which is Stephen Motu. In the Gainesville area, our Senior Vice President is Michael D. Holmes, and that's the actual Shands branch of it that's in Gainesville. And then we also have presence in Central Florida, which is Heather B. Long, our Senior Vice President there.
So to talk about our mission and vision of the organization, our vision at UF Health that we preach every day is to be the region's most valuable healthcare asset. No matter the region, we want to be the #1 choice for our patients whenever they choose healthcare. And our mission is to heal, to comfort, to educate, and to discover. So to give a little bit of background about UF Health, we're an academic medical center, which obviously means we're tied to the University of Florida, and we have the hospital side of that. And then we want to execute our mission through quality healthcare, elimination of healthcare disparities, medical education, innovation, and research. And so when we're talking about Jacksonville, we actually have 3 separate arms or branches that go into the actual hospital. So we have UF Health Jacksonville, which is encompassing our acute care settings, which is our hospitals. And then we have UF Jacksonville's Physicians Incorporated, or we call it JPI for short. And whenever you think of JPI, we just think of ambulatory clinics. So whether that be like an urgent care clinic, any outpatient clinic setting, our JPI arm, they'll staff the clinic, they'll run the day-to-day operations and things like that. And then to speak to the academic piece, we have our colleges of medicine, nursing, and pharmacy. There's obviously a lot of great nurses and pharmacists that actually come from FAMU that actually do rotations. I actually have seen, I think like 3 or 4 during the time I fellowship FAMU alumni that have done their rotations at UF Health, and that's always a great program that's been around for quite some time now. So that's kind of the 3 pieces that go into the actual health system that execute our mission, vision, and values. And so at a glance, our current layout, so as Brittney mentioned, that is our downtown hospital and located in downtown Jacksonville on 8th Street. That is where myself and Josie are housed in our admin suite. And then UF Health North, which is located on the northern end of Jacksonville by the airport. That's where Brittney is housed. And then we also have our UF Health St. John's Hospital. So this is a community hospital that was acquired 2 years ago in St. Augustine, Florida. So it's about an hour south. A lot of great things happening at that hospital to get them off the ground. They were kind of transparently struggling facility. And then through our merger acquisition, we were able to get their footing back under them. And then at the bottom, we have our freestanding urgent cares and emergency departments. So those are kind of a really rare type of facility. So if you think about it, in urgent cares, those are limited capacity, limited hours. You really can't even go past 5 o'clock most times. But with our freestanding ED and urgent care, they're actually 24/7, and then you can triage. So you walk in, if you need more emergency type services, you don't want to go to the ED in the hospital, you can receive services there. Or if you're more of an urgent care type case, you receive your services there, all in one setting of one roof, and then receive that appropriate billing. And then our last 2 facilities, these are beautiful facilities throughout Jacksonville. The UF Health East, we actually own the 2nd floor of this building. We work pretty closely with Jacksonville Spine and Pain Center. So think about it, if your patients have different spine injuries or orthopedic injuries, they can get their imaging done on 1 floor, and then you can see a specialist on the 2nd floor. So kind of get that full scope of services for that. And then UF Health Wildlife, that is located in Nassau County, so a little bit further north than Jacksonville. Another beautiful city that has family medicine, OBGYN services, cardiology, and orthopedics as well.
So looking at how we're growing, because our facilities are constantly evolving. Right now we are opening a 99-bed hospital in Durban Park area of Jacksonville, Florida. That hospital is set to open late August, early September. It's kind of evolving. But it will house a lot of different specialties. And it'll also have a medical office building where we'll have primary care, gastro, cancer is going to eventually be coming into that medical office building as well. We are also expanding and redesigning our ED and trauma center downtown. And that is in phase 1 right now, where we're expanding the existing facility by 35,000 square feet. And that's going to increase our rooms from what we currently have at 78 to 125, because we need those spaces. In phase 2, there'll be more renovations coming where we'll have new diagnostic equipment, radiology section, and a behavioral health space as well. We're also opening our 4th freestanding clinic in
January 2027.
Okay. Jared is working on that, so I'm confirming information through him. And also, we're doing primary care expansion into our St. John's market. So that's building off of that connection that we made with our Flagler Hospital. We're opening 3 primary care facilities down
And so to talk about our community impacts, obviously, like I said, UF Health being an academic medical center and caring about our most vulnerable patients, the community is what we do each and every day. And so as a fellow, we have opportunities to work on various community-facing projects. Our first being, this was Josie's project, the American Heart Association, the Heart Walk. So this is an annual event in Jacksonville where we raise money and raise awareness for heart health. There's a lot of big fundraisers going on and a lot of different organizations in Jacksonville that contribute to that. And then I unfortunately did not have the opportunity to do an actual community engagement project because mine was canceled. I was going to do something focused on men's prostate awareness in September, but due to unforeseen circumstances that got pushed back. So I was able to volunteer with the different projects on our Night for Heroes Gala event, and that is focused on serving our frontline warriors and our veterans that receive help at UF Health Jacksonville, receive care, and they donated a lot of fundraising to mental health awareness, to our brain and wellness center. And then also we have our Give Where You Live campaign, which I know was Brittney's project, and she did a lot of great work with fundraising for the organization as well.
Okay, so just quick show of hands. How many of you are familiar with exactly what a fellowship is? Have heard about it before or no? Okay, I was like, nobody? Okay, so a fellowship, to explain to those that don't know what it is think of it like an internship on steroids. So you get to come into the organization. Most of them are post-grad fellowships. So you would come into the organization, you have the opportunity to work with the executive leadership on their main priorities. Now, different fellowships are set up different ways. Some of them are rotational, some of them are project-based. The fellowship that we are in is more project-based. It is 1 year. When you come in, they give you the opportunity to express what you have interest in, because also the fellowship is also to help you figure out exactly what you have an interest in, what you might want to do, and figure out also what you don't want to do. So you get to choose different departments to work with. The approach that they took with us was they looked into exactly what were the main focus for the organization at that time. And they assigned each of us a different clinical growth plan, which are our service lines. And we were given full range to work on any projects that fell within that department. I know that I was assigned to gastro. I'm working on our new hospital opening. I was also working with our workplace violence and security department. As Jerry said, he was working with periop, ortho, neuro. So you get the opportunity to work in different spaces, learn different things. There'll be different projects. They won't all be related to the same thing. So there's an opportunity for a lot of skill development in different areas. And I know a lot of people ask about like post-fellowship opportunities. There's never really a guarantee that once you finish your fellowship that they will hire you. We do have a very good percentage of retaining our fellows. I think there's only one that I know of that did not stay post-fellowship, and that was his choice. So, and it's something that they talk about before your fellowship ends. So there are always talks about making sure that you have the opportunity if you want it, as long as you're doing a good job within your fellowship. So the mission and structure around our fellowship, like I said, we do projects. You will do rotations in the beginning of some sort where you have meetings and one-on-ones where you get introduced and you get an opportunity to speak with different directors, VPs, AVPs, and learn exactly what's going on in their departments. That's your opportunity to find out what potential projects there are that you could potentially help with. Also, another thing to note is that as you join these projects, your role could be different in each project. So you may be project managing in one, you may be assisting in another, you may be doing data for one. It just depends on what the need is, what you express your interest in, and what they think would be a good fit. There is also professional development. We have had multiple sessions with our HR partner who's been giving us project management experience, leadership experience, And they were very intentional about making sure that that was a part of our fellowship, because a lot of times your post-fellowship role may be a leadership role, so it's really important to develop those skills. And these are the different rotations that I spoke about and like project examples that you could be working on. I think we touched just about every one of these between the three of us. So you have an opportunity also, because we are an enterprise, to work on projects that are happening in Gainesville, happening in Central Florida, even though you're in the Jacksonville area. It does not mean that you can only work on things that are happening in Jacksonville.
Okay, I'll talk about my project first. So, as Brittney alluded to, we work on a lot of big projects throughout our fellowship and initiatives. So to kind of skip Brittney, I'll go to the middle and talk about me first. So my first big project I worked on was more like space utilization. So if you think of hospitals, you know, there are these big facilities and spaces at a premium, and we're always trying to expand, but you always can't, you know, build on what you have. That stuff costs money. So we need to think of creative ways that we can add on space in our hospital. So my first project, this was a Florida Blue relocation. So this is an external facility where we relocated our HR departments, finance, communications, development, and marketing department as well. So I started as a project lead for that project. I definitely coordinated a lot of things when it comes to, you know, making sure team members were having a familiar way of the land. If you think about it, team members, they're used to being in private offices, not being able to take calls with, you know, somebody right next to them. They're moving to this external facility that maybe live a longer drive from their homes. And so we just kind of had to say, hey, here's all the great things. You don't have to worry about parking. There's great food at the Florida Blue location. So those were a lot of great things that we saw. And then once that project was completed, we actually freed up over 43,000 square feet in the hospital. And if you think about that, you maybe free up 2 to 3 floors in the hospital for future inpatient growth. So super proud of the work that all the team did with that project. Our second one is my implant review initiative. So this is a system-wide project similar to what Brittney mentioned. So this was focused on our high implant utilizers and service lines. So we think about cardiology, orthopedics, and spine. If you think about an orthopedic surgeon, you can do a knee replacement, elbow replacement, shoulder replacement, and so they have various vendors that they can choose from. You can have 20 different vendors that can do one specific surgery. And so we have the opportunity to, you know, consolidate our surgical services and our vendor suppliers, and so we could, you know, have better negotiating power as a system, and then we can save approximately $10 to $13 million as a system if we approach this project correctly and fully execute. And so that is actually in the works right now. I'm still working through that. That's been my big one throughout the whole fellowship. It's taken about a full 8 months to complete. And there's still going to be work ongoing at the end of my fellowship. So I work with supply chain, I work with actual surgeons, work with different data analysts to work on cost per case data. So that was a great opportunity. And then lastly, my radiology and imaging service line broke. So we had an outpatient imaging department, and this was one facility that was losing patient revenue and patient volume. And so I was tasked being the project manager for that project and focused on recruitment volume. So just to give a high-level overview, this hospital facility was always being billed as a hospital outpatient department, and then that is higher out-of-pocket costs for our patients. And then so once that transition happened, our patients were annoyed, why am I getting higher bills for getting an MRI, CT scan, different type of radiology services? So I had to work closely with marketing, our patient access team to get communications out there. Hey, here are the pros of going to our facility versus going to an independent facility where you may be going to a radiologist that is non-credentialed, non-licensed. Here are all the things that come with our great facility. And then we actually saw some great revenue increases from the month of May to December. We actually saw a $3 million increase in that department as well. So as we see, there's a wide range of things that you can work on, from construction projects to clinical growth plan projects, just anyway. And also talking about our past fellows, so as Brittney mentioned, there's definitely a focus on retaining our fellows. We used to have the fellowship goes back to 2009. We still have the majority of all these people still in the organization. You can be a director of strategic business operations, you can be a director of Department of Surgery, various business managers across service lines. And so whenever you see this for individuals like myself that are still in that job hunting process, this is very promising to look at and serve as a reminder. As Brittney mentioned, you know, the fellowship is definitely focused on retaining the fellows because they put that investment into you to train for a year. They don't want you to go elsewhere and steal everything that you just learned at another health system. And so I definitely want to obviously stay with the organization and, have that return on investment and, continue to support any way I can. And lastly, for our application information. So this is still a work in progress, but I want you to focus on our application window. So this is July 20th through August 23rd. We are actually in the creation phase of creating our application packet. So this will be through an online portal. Previously, we had an email where you would send all your resumes, your transcripts, your letters of recommendation. So we want to try to do our best to consolidate that and make it as easy as possible. So we're actually creating this as we speak, but some things that will go into that, obviously your resumes, your undergraduate transcripts, and then we will have further details posted on our actual website. You just search UF Health Gainesville Administrative Fellowship, it will pop right up, and then in the coming weeks and months, you'll see the actual posting for our application. So with that, are there any questions that you guys have?
Do we want to let Jonathan go first?
Oh, we can do that at the end, yeah.
Yeah, then we just do questions.
No, go ahead.
No, you sure?
Okay. So while you're on the students' fund.
Okay.
Yeah, one.
Greetings, my name is Chandler Gaskin. I'm a second semester Master's of Public Administration unit from Montgomery, Alabama. And I was just wondering, on the past slide, why was there like a big gap between 2012?
Yes, I'm glad you caught that. Transparently, there was a refocus on the organization. That's not common. I mean, that is common across various organizations based on the needs. So obviously that was before our time, but the organization went through a rephase. The CEO at the time wanted to focus on other things, and then he felt as though the focus couldn't be put on the fellows. So thankfully, right before Patrick came back, or came as our CEO, he definitely made it a focus and a priority to bring fellows back to the organization. But even going back to 2009, 2012, those employees are still with the organization. So that's pretty common across different health systems that they're taking breaks and fellowships, which is unfortunate, but that's just what it is.
Greetings, I'm Ian Rentz, currently a third-year Master's of Business Administration student at Burrell University from Gainesville. So it's nice to see you guys. I have a question for you. So obviously, in your intro, you had a previous career. So what was kind of the biggest challenge going into the healthcare field?
It honestly wasn't that much of a shift. I think I try to tell people you have to focus on skill set more than like actual career field. Because regardless of what you do, there's a skill set that you can use to transition to anything else. So like using that mindset, it was easier for me to come over into healthcare. I started off in the clinical side and it just wasn't something that really worked for me, but I did enjoy the like administrative side of it. So the doctors that I was working with at the time were very open to allowing me to kind of get my hands into that, and I figured out that that's what I wanted to do. Good question.
Greetings, I'm Gary Smithson, a second semester Master of Health Administration student from Orlando, Florida. And I know you were showing us that there are various different locations like Jacksonville, Gainesville, Orlando, the Central Florida area. Which areas which areas have those fellowships outside of just Jacksonville?
Yeah, so we're currently in Jacksonville and Gainesville.
Oh.
There is definitely a focus on trying to expand the fellowship to all three regions. That might be a more Jonathan question, but hopefully he is okay. But yeah, we definitely, if you look at big healthcare systems, they have this, one centralized fellowship, and then you can place fellows all throughout the regions. I think that the region thing is something that's fairly new, and as the health system grows, hopefully the fellowship grows with that. So hopefully it's still an expansion.
Yeah. Also to kind of follow up on my previous question, what do you guys believe to be the biggest misconception in working in the healthcare field? Because as somebody that's a business major, I kind of assume, okay, I need a bit of history in med or have some idea of the medicine aspect of it. But what are kind of the misconceptions that you guys have?
So I can only speak from like the fellowship perspective of it. But like speaking from that, fellowships some hospitals will gear their fellowship specifically towards MHA because of the thought process that you're saying. But most fellowships are open to MPH, MBA, MHA. And if you think of it, MHA is just a healthcare business degree. That's literally what it is. So the kind of the same thing. You apply those concepts and skill sets that you learn to those healthcare, in that healthcare space. And also in a fellowship, that's what you're learning to do. You're learning to take the stuff that you learned in school and apply it in the real world. So that's the space to learn exactly how to do that, so that when you do get into your roles, you can use that thought process to address those healthcare issues. I don't think you have to have a clinical background. That's where the teamwork comes in. No project or initiative that you're working on will be solely just you. So you'll be working on teams with the clinical side of it, and you have to take all of that information when you're making those final decisions.
And to build off that real quick, you saw on the slide, Patrick, he actually has an MBA. And there's a lot of hospital CEOs and presidents that have their MBA without their MHA. So I would suggest that you guys, do your research with hospital presidents, look them up on LinkedIn and see their background and their career trajectory, and definitely connect with them to have that same thought process of, hey, I don't have the clinical side, but can I still fit in healthcare?
Greetings, I am Tanisha Mathern, a one-year MBA candidate from Florida. And piggybacking off this question, were you guys kind of looking for in candidates, and you mentioned like the skill sets, how you transfer your skill sets, what kind of skills you think would benefit us in that fellowship?
First thing that I want you all to really remember is be authentically you. You don't want to go into these interviews and you go in and you give them this representative that's not who you are, and then they pick you and you show up and then they're like, who is this person? So you want to make sure you show up as who you are, so that you, just like they're looking for a fit for them, you're looking for a fit for you as well. You don't want to end up in an organization that makes it a hard fellowship. It's not conducive and a conducive environment for you to learn just because you were trying to land a fellowship. Second thing, you have to be adaptable. There are plenty of days that we go in and my day starts and it looks completely different at the end. It may look completely different at 12 o'clock. The focus of a project might change from 8 o'clock to 10 o'clock, and you have to be able to kind of adapt to that. Healthcare is not a space for people that are resistant to change. The landscape is always changing, and you just have to move with it. Third thing, be coachable. You are not going to know everything, and while you're being coachable, be eager to learn. Ask questions, and not just to be able to say I'm saying something, but ask questions that show that you're really thinking through the process and trying to understand exactly like why we're doing what we're doing. It'll open you up to a lot of learning opportunities, because there's a lot of stuff that they sit down at the table and they know, and they're talking to each other and it's going quickly, and I'm sitting there, I'm just like, I don't know what they're talking about. But I can ask a question later and they'll explain it to me, and they go into great detail so that it makes it easy for me to apply it to other projects that I'm working on. So you never know when you're in a space where something that you ask and learn may be something that you can apply to something else. I want to do that.
I don't know who it is.
Okay. Greetings, I'm Burrell Mullins, a second year, fourth semester MHA. My question for both of you is, what was one of the biggest takeaways that you got from COVID that you find yourself using on a daily basis?
Connections to everything. It's such cliche because I hear Dr. Greenwood saying it all the time, but really all of our professors, connections to everything. As Brittney mentioned, healthcare is collaboration. You're going to work with various departments in various meetings, and then you want to know your personal brand. So, talk, whatever makes you breathe different versus the next person. You're easy to work with. Anyone's going to work with you and teach you and coach you to be a great fellow. And I know at FAMU, definitely get involved in organizations. The more that you put yourself out there in terms of joining healthcare related organizations or business related organizations, putting all that stuff in your resume, that stuff matters. And those are experiences that, might not be healthcare focused, but then you can take those same skill sets and then apply them, when you do these interviews and when you actually get your fellowships, or if you don't choose to go the fellowship route, you can apply that to any type of workforce that you decide to go into.
I agree. I say, be comfortable with being uncomfortable, because that's kind of what fellowship is. There are a lot of things that we get introduced to that we've never seen before, we don't have any knowledge about. But if you're comfortable, if you are open to being uncomfortable long enough to learn that stuff, you'll grow from it. And it'll be something that you can always build upon. So just give yourself room to not know, to mess up, to make mistakes, to be corrected, and it'll make your fellowship or any job, any new role a lot easier.
Greetings, I'm Angela Green, my first year candidate on the MHA program. My question pretty much was, I wanted to know a time you guys had a situation on the standard where you kind of maybe were working on the project, you did first say like the group that you were working with, but you had to use like certain soft skills, certain, skills in order to make sure that case still was a success. Does that make sense?
Right whenever you first said that, I thought about one of my main projects that I listed was my radiology projects, but I was with St. John's Hospital and our radiology department. So I'm coming in as the youngest in the room, and then how I got on that project, Patrick talked to the team. They said, hey, we have a new fellow, he's gonna be a project manager. I'm like, oh, okay. Can't say no. So I'm working with this team, brand new. And then as we began to have weekly meetings to talk about, hey, what's going well, what's not going well, what are our patients saying, and I had to relay that information. There was some disconnect. I'm hearing that, one thing is happening on the front lines. You guys are seeing your patients say this one thing, but the data may show something else. And then, as a fellow, we have access to different data and be like, hey, so can you help me explain what this is? And then people can get defensive. They're like, oh no, that's not what happened. So you kind of have to definitely have an open ear and not, accuse team members, because they can get very defensive. I've been doing this for 25 plus years. Who are you to come and tell me how to do my job? And I'm like, no, that's not what I'm saying at all. So definitely going into any new project or any new role, you have to take that mindset of being a listener first. Say, hey, I'm here to support anything that you guys need help with. I can definitely push things forward. I have access to leaders that, quite frankly, they might not have easier access to. And so to be that bridge and that middleman from the frontline staff to your leadership that can make the decisions, I think that was a big transition early on, but towards the end of the project, we were joining meetings and talking about, things with your family. Hey, how was the family? How was the weekend? Things like that. So that definitely grows over time, but those situations do happen.
All right, so let's give them a round of applause. I want to have you all keep at the top of your mind the word connection, networking, relationships. Connections, networking, and relationships. The next gentleman I'm going to introduce, I believe, happened because of those three things. So I get to talking with this gentleman and find out that he is working with Deloitte. How many have heard of that? The consulting firm, as well as teaching, and that's why he was there. So then he get to talking, and he's like talking about the things that are happening in healthcare, the trends, and all of that. I said, what? I got to connect him with a fellow faculty member. I said, Dr. Greenwell, you got to meet this gentleman right here, like that. And so then Dr. Greenwell met him, and then we got to talking, and that was good. And so just developed a great, time there. But Dr. Greenwell carried on the relationship because we later found out that he had been one of the judges in the case competition. He's written cases because of his work with Deloitte. So we needed to keep him close to FAMU and our Master's in Health Administration program. He's gonna tell you all the other things that he's doing, and I'm glad to hear that he's now at UF in Jacksonville. And we're glad to have him in person and to bring him to you all this evening. So with a round of applause, would you welcome Mr. Waller? You want to start?
I can do that one. Hey, everybody, good evening. How's it going? I'm Jonathan Waller. I Assistant Vice President of Strategy for UF Health. So I'm based in Gainesville, but I have a whole system enterprise, 6.5 million, 7 hospitals, 3 different markets, all growth runs to me. So I report through our System Chief Transformation Officer, Jessica Melton, and then they're all a part of the C-suite. We run through Dr. Stephen Melton. So really glad to be here with you guys. As Dr. Woodley was saying, it's been a long time. I think we met, what, 4 years ago at this point?
Yes, exactly, COVID.
Yeah, it was post-COVID in DC. Yeah.
In DC?
Yep, in National Harbor.
National Harbor.
So yeah, it's been a long time coming. So I've been able to get to know her and Dr. Weir pretty well, and be able to build relationships over the years. And then of course with Brittney and Jared coming in, I remember watching you guys' case presentations for Nasi over Zoom and giving you guys feedback. You guys did well in that competition. But honestly, I wouldn't be here if it wasn't for them. You know, I love HBCUs. I love giving back. It's beautiful to see all these black students in here. But without that pull of saying, I know them, I know they're good people, I'm willing to pull up for that, it wouldn't be that. So relationships are everything. And I'll walk you guys through sort of my career journey. How much time do I have? Before it's my time, I will stay as late as y'all want. I'll be honest, it's pretty hard to catch me. So I made the drive here. I got to drive back tomorrow. So I'll answer whatever questions y'all got. I'll tell my whole story if that's what y'all want. I'll
I
answer.
want to hear the plot twist. What's up?
Oh
my God.
So the plot twist is I'm currently single. She felt like my career was most important. So I'll talk to you guys about the sacrifices you gotta make on this career journey. So whatever it is you guys want to follow, I can email it to somebody. So as I type this, I'll begin to use.
Y'all are funny. Oh my God. We got like 15 minutes. 15 minutes.
Okay, I'll just quickly overview. So I don't even need the slide. I was going to give you guys just some content. So I'm a native of Flint, Michigan. I'm starting off with the background. Native of Flint, Michigan. Went to the University of Tennessee, Knoxville for undergrad. I did my master's at the University of Michigan in Ann Arbor. From there, I did a fellowship like Brittney and Jared. I went to Columbia, South Carolina. It was a system called, at the time, Palmetto Health. Now it's Prisma Health. It's the largest system in South Carolina. I took that because they promised me I could report to the CEO and the board chair. When I was at school in Michigan, they had CEOs. Well, back up. University of Michigan, the reason I went is because they produced the most black male CEOs in the country. So for me, I was like, what better place to go than they have proof of concept here. So I went back home, went to Ann Arbor, I did 2 years there. My fellowship, I said, okay, they bring all these CEOs to campus. What do y'all actually do on a day-to-day basis? And so I wanted to get closer to that. So I chose a fellowship that I said, y'all gotta promise me I can report to the CEO and the board chair. And that's what they did. And so I went down there, it was a fellowship program that gave me all the access, office in the C-suite, all that jazz. And I saw, from my graduate school curriculum and just general experience, they were gonna have to merge. They were gonna have to get bought. And so I asked the CEO, his name was Chuck Beeman, I said, Mr. Beeman, do you think we'll ever get bought? He says, we'll never sell. My intuition told me differently. And so I thought it was really interesting that I got to work at this system. We had 6 hospitals, 14,000 team members. I was like, what does this look like nationally? We had been fortunate in national case competitions in grad school, both Nasi and Cleveland Clinic. We took first place, and Nasi was for the Atlanta market, Cleveland was for their London hospital they opened a few years ago. So I had seen different things. So I said, I want to see something different. Connections, I called an old professor from Michigan. She said, funny enough, I'm starting a new firm. I'm going to build out a firm I already had. Do you want to be one of my senior consultants? So I took the role. They sent me to Toronto, Philadelphia, Phoenix, Atlanta, and had me leading projects. She gave me an opportunity. She didn't have to. She gave me an opportunity, and she let me do that work. I did that for a couple of years, and then I decided, when you decide to build a hospital, you're at the back end of strategy. You guys already looked at the market, you decided you're going to build this. I said, I want to go upstream. I want to be the person that makes the decision that we're going to do this. But you got to build the technical skill, and that's a big piece of what I want to talk about is, I said, I got to have the chops to be able to run the data and be confident in decision making.
and see different things. So I went to a firm called Chartis. It was the Chartis group back then. I think it's pound for pound the best healthcare strategy firm in the country. And you know, to be frank, excuse my language, I got my ass kicked for 3 years. But you gotta, look, learn how to fight, you gotta get beat up. So to me, they put me in these very difficult situations with these crazy timelines, these crazy data analyses, these weird people on my projects, but you gotta figure out how to survive. And so that's what I did. And so I did that for 3 years. I loved it. I actually left because at the time I was living in DC and I was staffed in Seattle, so I was on a plane 12 hours a week, and just, it was awful for my personal life. And at the time, Deloitte was recruiting people. We can talk about money too. They gave me a large signing bonus. I bought a crib in Chicago with it because executives who were black and Nazi told me, you gotta get into real estate. Like, you need to be paying yourself for where you live. I didn't know that. My family doesn't own any property. There's not a lot going on in Flint, Michigan, it's not. But black men put their arms around me and gave me that game. So I took the money, I bought the property, I still got it to this day. And I took the job at Deloitte. And at Deloitte, I moved between Boston, Chicago, and Atlanta. And I did my thing. I worked on mergers and acquisitions, enterprise strategy, financial performance improvement, biotech. Got to work with some of the sharpest minds in the industry. I did the same work at Chartis. And then connections. When you're in strategy consulting, if you want to be a chief strategy officer, and I wanted to be that, I aspired to be that, what they tell you is the first job you take post-consulting is a director of strategy role. Well, there's this white guy out at the Children's Hospital in Colorado, a short Jewish guy by the name of Ray Schwartz. He was employee number 7 at Chartis. I didn't know him, but I knew he worked at Chartis. So I LinkedIn DM'd him, he posted this role. I said, hey man, you know, would you let me be hybrid? I'll fly in from Atlanta twice a month. He said, no, you gotta move out here. But we had this conversation. He was like, just hear me out. And so they made me an offer. And you know, in that offer, again, as you build your reputation in the industry, he sat me down the night before my interview. He said, look, I know you coming in here for this director of strategy job. I want you to think about what your job is gonna be after this, because I called in some references. They told me if I don't promote you in a year, somebody's gonna come after you. And I said, that's not what I was thinking about. I'm here to interview for this job, but okay. So we go through the process, they make the offer, I take the job, I move to Denver. And sure enough, 7 months into the job, I'm sitting there, Jessica Melton, the Chief Transformation Officer at the University of Florida Health. She calls, she says, hey, I was at Hopkins, I took this CTO job, I know I've been trying to get you before, but would you be the vice president of the total health system? I said, hell yeah. So really hard, because someone who took a chance on me gave me an opportunity in Denver, and they gave me everything, they treated me great out there. A bigger opportunity came, so I had to make a hard decision to leave. And there's risk in your reputation. Now you look like a person who jumps jobs or whatever, but I don't see too many black men getting these opportunities. So for me, it was something that was not only for me, but you know, hopefully be able to set the example that we can do these types of things. And so it's been great coming in, it's been crazy. We're going through a massive transformation. I generally work across the C-suite in all of our markets. We're talking about growth, we're talking about partnerships, we're talking about physician platform, you name it under the sun. Anything that goes through growth has to see my eyes before it goes to the C-suite. So they've given me that ability, that authority. I'm setting up a system office. I get to hire people, and my team, my people. End of the day, we got to execute though, because I know, you know, it's fun to say that I'm young and I have this job and it's lit, whatever. But if I don't produce, they're gonna get me up out of there. So that's what matters most to me. That's why I work late. That's why I work hard. That's why I got this gray hair. I'm not even 40 yet, but I see it as something that, you know, I feel like God has given me an incredible opportunity, and I'm not gonna drop the ball. So we can talk about anything y'all want to talk about. I know y'all got questions. It can be on the record, off the record. I keep it real.
I want y'all to ask like hard.
Yeah, ask whatever you want. Whatever you want.
You won't get an opportunity where you have like he was saying, like black leadership, male leadership, female leadership, either one. And you're in a room where it's safe for you to ask whatever you want to ask. So don't miss the opportunity. Ask him hard.
I work for Minnesota. I ain't supposed to be here. So, you know, y'all better ask. What's up?
So, when you were graduating,
Introduce yourself.
my apologies. Greetings, I am Steve Pierre, a second semester Master's in Health Administration scholar from Rockland, Florida. And I wanted to know, when you were graduating undergrad, did you have an idea of exactly where you wanted to go, and how did you go about that?
Great question. Another connections again. So I was a sport management and business major. I actually had an internship with the Detroit Lions lined up. The NFL lockout happened, canceled, right? So I took a job, or internship for the summer with the Maryland National Capital Park and Planning Commission. So Parks and Rec, large scale like urban planning stuff. And all of the urban planners in the building went to the University of Michigan. And they were like, you should look into this program. The program director at that time was a black woman. And she said, it's funny you reached out because we're looking to bring more black students. So you bring yourself and another person or however many you can find, we'll bring out in Ann Arbor in the fall. I go. And this is the importance of white people in your network too, all right? I run into them, I'm serious. I run into this dude I went to high school with, man. We used to play video games after school. We had like basic drafting class together, whatever. A guy by the name of Sean White. I'm sitting there and I'm talking to Sean and I'm telling him what my goals are. He goes, man, look, hear me out. Like for what you want to do, you might want to think about healthcare administration because like you can do the same thing, same impact and make like triple the money. Plus it's like hella black guys in our program who like going to be successful. Like that's what he said. So I was like, all right, let me hear you out. So he introduced me to this black guy by the name of Cameron Glenn, who now works in Atlanta. And long story short, I went home and I told my mom about it. She was like, don't Miss Price from church run the hospital in town? I said, I don't know. The girl I took the 9th grade homecoming, her mother was a hospital CEO. I didn't know what this woman did. I swear to God, I did not know what she did for a living. So, you know, I'm in college now, so I text her, I'm like, hey, can I get your mom's number? I call her mom. I'm being honest. I said, can I get your mom's number? I called her mom. I said, hey, Miss Price, this is Jonathan Waller. She said, I tell her what's going on. She said, what are you doing tomorrow? It was a Sunday. I said, I'm on winter break. She says, drive to Toledo to my office. I drove an hour and a half. I sat in that woman's office for 8 hours and just watched her day. And she said, this is the kind of money you can make. This is what the family lifestyle is going to be. These are the pros, these are the cons. Go to Michigan. That's what she told me to do. I had no interest in public health or working at hospitals, nothing. And so I said, all right, I'm going to apply. I applied as a dual student. I got into both, and they were like, you didn't get any funding from urban planning. You got a 50% scholarship from the School of Public Health. I trusted God's path. Sometimes you need to put your options out there and ask him to shine light on which one is the right one. So I just followed the light. There's a book from Matthew McConaughey called Green Lights. Read that book. He talks about as you drive down life's road, just go where the green lights are sending you. Stop trying to wait for red to turn green, or for yellow to go red and green. When you see green, take that path. If you're living right and you're putting your best into the world, it's just gonna open up naturally. And you'll get used to those green lights, but you also gotta take risks, man. Like, don't get me wrong, I get it, I look successful, whatever, flashy suit. I'm taking losses too, bro. Like, you take L's, but you get stronger from it. You get calluses. And ideally, the two things that can really ruin you is a bad marriage or a DUI. Those are really the only two things that can sink you in your professional life. I'm serious. I'm serious. Because what they don't tell you is, you get to a certain level, you start making money. You hang around other people making money. Y'all like to go out and be flashy. We family, bro. We black. You got a section, y'all out getting with it. You done drove your AMG out. You trying to flex. Now you done drove home and got a DUI. You lost everything. Pay $100 for the Uber, man. Serious. There's so many people who take that loss, and it's as simple as that. If they find out you got that, you over with. Smoking weed. Start smoking cigars, man. Stop smoking weed. Like it's little things like that, honestly, where black people mess their opportunities up. Because we trying to be cool. Like, you gotta level up and change your hobbies, man. Like, it's little things like if you want, go to the hookah bar, smoke hookah. If you're applying for a job, see if they test for nicotine. It's little things like that that get us tripped up from life-changing opportunities. So, next question. Is that helpful?
No, absolutely.
Greetings, Garrison, that's here. How would you, like, I know you said you take a lot of losses, it's a lot, it sounds like you have a very busy schedule. How does your week sound like? Like, how does your week go about? Because I know that it's probably very hectic. It sounds like it was very costly in a relationship, so like, I'm just curious how that goes on.
Yeah, no, I mean, what they said on steroids, man, I mean, I can give you today, for example. So, Yesterday, I had to sit down with my boss and say, okay, for this company, I think that as we stand up our enterprise strategy office, we lack a governance structure beneath the actual office where we can actually make data-driven decisions for growth and hold people accountable down to the middle management layer. That's about a couple thousand people that we're talking about here. So she says, okay, we'll draw up what you think should happen. So I spent about 40 slides drawing up what I think should happen. And she goes, well, can you present it to the CEO tomorrow? And so, I mean, what am I gonna say? No, like, you know, so I sent it to her last night. I'm like, cool. She's like, the meeting's at 8:30. I get up this morning, 7:30. She's like, I got these edits. Can you have this done and sent by 8 so they can have a pre-read before the 8:30? So I got, man, I'm trying to brush my teeth, I'm typing, I'm trying to get it done. We get it done, I go in there, the CEO, the CFO, the Chief Clinical Officer, the Chief Legal, the Chief Transformation Officer, and the Dean of the College of Medicine are sitting at the table, and they expect me to present it to them. So I run through it, 40 slides, we sit there for 2 hours, we go through it. You know, we get off the phone, the market president from Jacksonville is like, hey, there's a physician out here in St. Augustine, they want to sell their practice, I need somebody to hop on this call with me, can you do it? Gotta get on the call with them, right? There's an Epic Community Connect project we're trying to get funded, that's gonna be $4 million a year, I gotta get on there and check somebody's work. We got our senior leadership council today. I walk in there, somebody wanna talk to me about some restructuring I did last week, somebody wanna talk to me about, you name it, under the sun. You know, you end up living a lifestyle where, you know, I sought opportunity for so long, but as you build, now it's people looking for you, and you gotta manage your time. Because every given day, 10 or 15 things that happen that actually requires my attention, but does it really? And so I think you gotta build the strength to say no, but I think beyond just saying no, you explain to people why without making them feel like they're unimportant. So that's a skill you gotta build. And also, man, you gotta get out of Dodge, man. Don't be hanging out in the hallways. Like, you gotta go to your office or go over where you're supposed to be, because you constantly get things assigned. Strategy is a catch-all role. Everything is strategic, technically. So, you know, I've had to be thoughtful about, you know, how I move and use my time.
Greetings, are you talking about like kind of a little bit like personal life and stuff like that? How did you separate, or how do you, in a sense, right, separate your personal life or me time or whatever you're trying to do in your natural life versus like how you are in your work life, or you know, like the things that you have going? Right?
Well, you don't. It's called work-life integration. So I can give you guys a clear, like I said, I'm gonna just give y'all the real. So, you know, coming into this job, I knew what it was. And anytime, like, even in dating, like, the way I explain it is, dating me, you're trying to jump into a moving car, right? Like, my life is my life, my career is my career. It can allot and afford a wonderful life for me and someone, but like, this is kind of how it goes, unless you can show me a better option, which, I mean, that's great, I'm open, I'm amenable to it, but it's kind of hard. So for me, you just gotta decide that you're gonna make it happen. So unless I'm leaving the country, like for example, I gotta go out of the country in a couple of weeks for a bachelor party. Like I'm actually out because we can't work on our laptops outside of the country. But last week, I had planned to go to the Miami Open all year, tennis tournament down there in Miami. I said, all right, I'm off for the day, but it's not a great time because I have to hire the system office. So I got up at 4 in the morning, I drove to Orlando, I got on the Bright Line, and I worked on the Bright Line. When I got to Miami, on the way to the Uber to the hotel, answer emails, change, go to the stadium, watch it. I had somebody in my chapter down there, we linked up, we got drinks. In the morning I got up, I had to fly to Columbus, Ohio for my job in Minnesota. I landed at 11, I got to meet the kids at 3. From 11 to 3, get on the calls and get it done. On the Uber on the way to meet the kids, call your mom, make sure she's good. Get there, work with the kids, we gotta go to a dinner, we do the case time for 10:30, go to bed, get up in the morning, work out, answer a couple emails, go present. When they get done, I go to DC for the weekend. So I'm trying to get to DC. On Friday, I know I'm not doing nothing on Saturday, so answer everything I can on the plane. I get up in the morning, I go see the cherry blossoms, I go hang out. I'm out all night till probably 2, 3 a.m. Get up in the morning, 10 a.m., answer some emails, go watch the Michigan versus Tennessee game, because it was my 2 schools. Then I gotta be at the airport by 7. I gotta get to Orlando, so do all my work on, I know it's a lot, right? Do the work on the flight. I get there, I drive all the way back, and then game time on Monday. You just gotta make it work, bro.
No, so like, no, that's not a bad, like, I like that, you know what I'm saying? That's not a bad job, you know what I'm saying? But I'm just trying to figure out, like if like someone was to have like a wife or a girlfriend or a significant other, like where you fit in there, how do you like, you know what I'm saying? That's really what I'm trying to do.
You gotta carve out time. So for me, when I was in a relationship, and when I am in relationships, like my typical thing is from 6:30 to 8:30 on a weeknight, you got it. I ain't looking at nothing. We can eat dinner, we can do whatever you wanna do. Monday through Thursday, 6:30 to 8:30. And then after 8:30, it's a flex. If I got more to do, I'll do it. If I don't, if it's not must-do things, then I won't. But other than that, like, from 7 a.m. to 7 p., don't expect to hear from me. I'm at work. Like, what you want to do? Like, I get it. I'm not there during the day, and if you can't take being lonely or finding something to do for yourself, then it's just not a good fit. But I don't hear that same talk when you're trying to go on vacation, or you want to just kind of get it. So what you want to do? You know what I'm saying? Like, but you gotta have those conversations. Unless you meet somebody early in your life, so y'all be sitting together, like very early in the game, like I have to sit her down and be like, listen, I ain't seeing no other chick or nothing like that. I'm actually that busy. Like, and I'm not even trying to be pompous, right? But you have to explain to them, like, this, I go to these conferences, like, I'm on boards, like, when I'm gone, I'm out of pocket, But when it's free time, we can do whatever you want under the sun. That's all I got, bro. Like,
Okay, so I'm gonna do the brave thing by asking the same question that was asked twice. That was asked twice. So greetings, I am Kennedy Alexis Warren. I'm in my first year, or I'm in the start of my MBA program here at FAMU. But I have been looking at healthcare management. We're all down here. But I'm kind of concerned on how I would stand against someone who is in their MHA program or has that medical background. And I know we talked about the skills, but are there any certifications that I should be looking at to, or maybe internships I should be looking at just maybe within the summer, or maybe certain jobs, should I go work at patients first? Like, what should I do specifically? Not like a soft skill, but something that is gonna help me stand out against someone that's already in this program.
yeah, you just gotta go the extra mile. Biomedical terminology book, volunteer in the hospital. Even when you get into jobs, even when you know these things, everything is teamwork. So sometimes you need to have a meeting before the meeting. If I know I'm about to have a meeting about cardiology with these people, they ain't the only people in cardiology. Go talk to somebody else and get intel. Tell me what's going on with the department. The biggest thing that you're gonna provide value with at any point in your career, y'all, come in with a perspective, an informed perspective. The number one thing I hate is when somebody waits for me to tell them what to do. And when I get back from telling them what to do, they did exactly what I told them to do and nothing else. Bro, what's the point? Like, come on, like, seriously. And people want to be paid like a 1.0 FTE, but you're moving like a 0.3. Like, what we doing? And I'm being crass with you because that's honestly how I feel. I can't, when I'm in management, I can't say this on a day. Don't tell nobody to say that. But that's how I feel. So I think there are skills you can build. You need to know Microsoft Excel. You do. You need to know how to put a pro forma together. Wall Street Prep has like entry-level courses. When I was trying to get into consulting, paid $35. I went to the public library every night and just worked on practice modules. They give it all to you for $35. Watch case interviews on YouTube. You can be the person you want to be today. You just gotta train your brain to do that. And a lot of people just want life to happen to them, or they let life happen to them. You can grab that thing by the horns, like you can. It's just a matter of everybody said they want to be something, so they gotta do the work. And it's gonna cost you long nights, it's gonna cost you weekends, you can't go on every trip. But it's just coming on how bad do you want it. After a certain threshold, everybody's smart. There's like a baseline level of like smart, do you look the part, does it look like you tried, you got a haircut, does your suit match the top and bottom? Whatever. After that, who's gonna do the work? That's what I care about. That's what the people at the top care about. Because at the end of the day, when some expletives go down at 7 p.m. and y'all gotta get it done, who's gonna pick up the phone and get this done? And you gotta work like you're making big money before the big money comes. It doesn't just fall out of the sky. Like it doesn't. And I think a lot of people expect that. And so I have some other perspectives I'll share in a little bit. Any other questions?
Yeah, so greetings, I'm Ian Rentz, I'm from Gainesville, Florida. I'm currently in my MHA here in Florida. And kind of piggyback on her question though, what specific certifications do you have? And then also, in addition to that, what has it been kind of like living in Gainesville? And how do I say this? How does the University of Florida affect you guys and the healthcare aspect? Because imagine there was a huge shift with UF itself. How would that kind of affect our lives?
Good man. You asked like 3 questions. Okay. What was the first one?
What certifications do you hold? And hard skills do you hold?
I don't have any certifications per se. I think that, you know, I'm working on my fellow for the American College of Health
Healthcare executive.
yeah, my FASHE. I'm ready to sit for the exam. I just haven't had time to actually schedule a date. That's helpful. I mean, to be honest, my resume says I worked at Charters and Deloitte.
Right.
So they know what time it is. You can't work at those firms without being able to really chop some stuff down and get it together. So I chose that for a reason. I said, I want, when you look at my resume, you know what time it is, you call my references, it is what it is. But I got my ass kicked, I'm just telling you. So that's what I have. But I think, you know, there's other things, you can get your P&P, all those things. But I would say if you want to build hard skills, the #1 indicator is, does the job have an Excel test? That's going to tell you what they got. And also, do they have Lenovo ThinkPad laptops? That's like the Ferrari laptop. That means they got a hard job. If somebody got that laptop, they got a hard ass job. I'm just telling you. If you want. But I sought out those really difficult jobs because I knew I was younger. I didn't have nowhere to be but to build. And like, it just comes down to your why. I'm from Flint, Michigan. I ain't got no real home to go to. Y'all, anybody been to Flint before?
Yeah, my dad from Detroit.
Okay, so yeah, my mom was saying to me, ain't nothing in Flint though. Yeah, but for me, it was always the hunger for more because I ain't going back. I'm just not. And I felt like that's an advantage. Like, people talk a lot of trash about the water crisis and the murder rate and all of that. It's turned into an advantage because at the end of the day, when it's cold and it's dark and nobody wants to do the work, I got a place that I can go to say, I ain't never going back there, so I got an extra gear. That's what I feel that I have personally. So think about how you use your disadvantages to advantages, because it will get to a point where it's gonna come down not to your skills, but to your work ethic. And your work ethic should help you build those skills. All right, what's the second question?
Well, really the second and third, but how does University of Florida kind of affect you guys?
Yeah, that's a great question. So we are an academic health system. We're inextricably linked to the university. The way it works is, okay, I wish I had a whiteboard, but you got the university president, this guy by the name of Harold Landry. He oversees everything with the university. When you come down, the health system is really, it's the dean of the College of Medicine oversees the College of Medicine. All of our doctors in Gainesville are employed by the College of Medicine. However, the CEO of the clinical enterprise is Dr. Motu. He is not employed by the College of Medicine at all. But the president of the university reserves the right to fire vote. So we have to work hand in hand. And by the way, there's actually a role called the Executive Vice President of Health Affairs that is dormant right now that's supposed to sit between Motu and the dean. So it's really supposed to be a 2-level up. But we cannot hire any, in Gainesville at least, we cannot hire any non-University of Florida doctors. If we want to set up any community physicians, we have to get signed off from the university president and the provost. So I'm not a UF employee, but everything that I do has to be run up the flagpole. When we tried to get a bunch of money approved for a facility master plan, we had to go to Daytona to the university board chair's office. So he's the boss of the president, that's the big dog. So we gotta go think about that, how much power this man has. He's the board chair of the University of Florida in Gainesville. We had to go to Daytona. We go to his house. So that tells you the real person who pulled the strings is him, and he's appointed by the state. So we deal with a lot of public things because of that. And I don't know if you guys are aware with the whole university president situation that happened with Santa Ana.
Same thing.
Yeah, y'all had that here. Yeah. So yeah, we're a public entity, pretty much controlled by the state. Yeah. Now, we can stay over if y'all want. It's up to y'all. Like I said,
2 more, and then we'll disband, and those who want to remain.
My my question is, being black and educated, what's one of the biggest challenges that you face? Not only gaining freedom, but coming up to where you are and how you overcome it?
Man, I don't know. I don't think about it like that, man. I just, either you a dog or you not. That's how I look at it. Like, it's just, that's really how I feel. Like, it's just, I think for me, and I actually think this is the challenge to all of y'all in this room. There's a polarity of going to an HBC. I'm gonna tell you, there's a really bad part, and there's a really good part. Which one y'all want me to start with? Good or bad? Okay, I'll start with the good. I think that going to an HBCU is truly a one-on-one experience. You're always gonna have a home, you're always gonna have a community, you're always gonna have just this, the essence of this, the energy that emanates off of you when you go into the world. You can feel it, it's palpable, that's wonderful, and it cannot be taken from you. The disadvantage is, white people don't really know that, and you're gonna have to work in corporate America, okay? So, it's a balance where you guys are gonna have to stand in your royalty, but also understand, y'all gonna have to let these people know. But in a way where they don't even know you go to an HBC, but they know you about that, like for real. So I think it is a balance, and I've seen it be challenging for HBCU students, because one thing about HBCUs that they do well is they really uplift you when you come to an HBCU. They tell you that you're special, they tell you that black is beauty, they tell you that black people have wonderful brains and that we do all of these wonderful things that we don't get credit for. But you going into the land where you're not gonna get credit for it. So how do you use that to fuel your confidence, but also realize it's gonna have to be things that you're gonna have to adjust to the game and be resilient in a different way. You're gonna have to go to that hockey game. You're gonna have to be at that happy hour where they playing Wagon Wheel 100 times. You're gonna have to sing Shania Twain on karaoke. It comes with the job. And you cannot be the black person in the corner. You cannot be that. You can't do it. You gotta figure out a way to maintain your blackness and be in the mix. That's a skill. That's actually a skill. And so I encourage y'all, if you don't have them, get some white friends. I'm serious. I'm so serious. Like, if you want to ascend in corporate America, that's what the environment is more than likely gonna look like. And so you don't have to assimilate per se, but you need to know how to get in there and do your thing and then go home and take your polar bear suit off. Like, it's a real thing. So, I think that is something that you have to do. And then, honestly, you know, we have to work twice as hard. You gotta prepare. You gotta be ready. You gotta come to meetings prepared. And you also gotta speak up. And I think you gotta learn. You'll learn over time. Picking your spots in meetings, it doesn't mean you gotta say a bunch of things. But they do need to know you're not just a diversity hire in the corner. Right? So are you saying thoughtful, insightful things where it's clear you thought critically about whatever the problem is? And to the point where people talk to you after the meeting and people are saying like, hey, we should talk about this before the next meeting. Like, you want to do that. And so it's like understanding race, but trying to take race out of it as much as you can when it comes down to performance. Does that make sense?
Yes.
Right.
And the last question,
when you talk about like exposing or not, you said like you would go like your shop or whatnot, like I wanted to ask, like, were there any networks out of whatever like organization that you were in that maybe like close you or catapulted you to a different like position, like as you were triggering to your career?
That's a good question. So I mean, yes and no. I think that's, I pledge captain. So for me, it was, when you go to like these black healthcare conferences, for example, if you don't know anybody, the bond is an easy way to meet up with some brothers. Like that helps. But then beyond that, I mean, you know, for me, I specifically chose the University of Tennessee and University of Michigan because they have very large alumni bases for black and white people. Like, I was strategic about that because people don't care that much about what you can do after a certain threshold. It's about can they relate to you. So whether you black or you white, if you see my resume, they're like, he can talk Big Ten football, he can talk SEC football. Michigan's in the Final Four. Like, automatically got something to talk to me about coming in. Those networks and using that to be able to make those connections, small things, because if we're being real, not that many people actually want to come to work every day. Like, let's just be honest about it. Like, and so So how can we build connections where it's like, look, bro, you gotta be here, I gotta be here. Like, what's up, man? We're gonna get to the work in a second. Like, did you watch the game yesterday? So, just think about different things. Golfing. I never wanted to golf in my life, but I'm having to play it now because all these folks golf. That's part of the game. Like, you have to be able to assimilate and do that, right? We got the Equestrian Center in Ocala. I do not care about a horse, bro. But like, you need to go down there and see all those things. So yeah, it's various networks. But yeah, it can help, but it's beyond just a fraternity or one professional organization. Everything you stand for, wherever you're from, wherever you went to school, whatever kind of music you listen to. Next time you with somebody random you don't know, ask them, what's the top 3 concerts you ever been to? You don't know what they're gonna say, but like you might have something to relate there. So just looking for points of connectivity is just the way to go.
Wow. Jonathan! Wow, we had that conversation at that conference. He is that guy. I'm telling you. And we started and then we kept going and we kept going. And so we just had to stay connected to Jonathan. So we have 2 things. We have Dr. Greenweir, who is here. Yes. So she carried on the court. So we're very grateful for that. And then we'll wrap it up with Attorney Stroud giving some last remarks in terms of the Division of Healthcare Management, because we the hosts. We the hostess with the hostess. Right?
It's on me? All right. First off, I'd like to say thank you to our guests, Jared and Brittney. You all don't realize how proud I was sitting back there listening to y'all. I remember when you all first came in, I put a wager that I knew was going to cost me a bunch of money. And well, I'm so glad I failed somebody. No, I promised them that if their whole cohort, I think it was 11 of y'all, right? 13. If everybody got a 4 point on their first semester, I would find a way to pay for their next semester. And they came real close, real close. I think they may have had 137 and 138 to knock them out. But they thus far since I've been here, they have been like a superstar cohort for us. I mean, they went through, and I always tell cohorts coming in, and I don't know where you are together in your cohort, but if you start together, you lead together, all right? You don't let anybody fall by the wayside, all right? You lift each other up, you help each other out. Not saying that you cheat, but you may have a skill that someone else doesn't. You help them build that skill. So sitting there, listening to them, watching them, it told me that we're doing something good in this program. And I know what you have in SPI. So you are in a great position. You will learn a lot, but as Mr. Wallace said, you have to make those connections. And initially, some of them are going to be uncomfortable. You're going to have to be around some people that you don't like, some people that you don't know how to connect to, but as you grow in your career, you will get that. So I would just say, if you can, connect with them, stay in touch with them, because, you don't get this every day, all right? Thank you all.
All right, thank you. That concludes our program this evening, but QR code for attendance. Oh, QR code for attendance. Thank you. And our guests will remain for until questions are answered, so that. Yeah, y'all can get what you need. What did you think? What did you think? Tell me about it.